Well, listen, then let's make it fun. And my daughter's in the
Okay.
background, so if you hear chewing, then she out here.
Okay.
There
If
she
you hear
go. There she
Drew,
go.
hi, how are you?
That's my 9-year-old.
She's so
And I know you
cute.
got to get your kids in a little bit, but I'm glad. So you finished your clinic and you got to go get your
Finished,
kids.
finished retrievals. Yes.
What I want to know from you, and what I know the people want to know from you, because I sent you a bunch of questions, but you know what they ask me all the time, every day, is when should I start checking my fertility, or how should I check my fertility? And what does that even look like?
What does that even mean, right?
What does that even mean? That's the
What does
question.
that even mean? It's a very good question. I'm gonna give you the best answer that I have, okay, which is I think when people think about freezing their eggs or fertility, we know as ladies that unfortunately age plays a major role, right?
It
And the
does.
reason why is because unlike men who make sperm daily, we are born with as many
All
eggs
of
as
them.
we could ever have. All
With
that we're
all
gonna
of
have.
them.
And the unfortunate addition to that is that we don't just lose one egg every month, like the one that we ovulate, we lose a group. Okay. And so I think the earlier that you can come in, maybe like early 30s, that's kind of when we say to women, if you're gonna do egg freezing, if you have the means or insurance coverage, early 30s is best in an ideal world. Now, here's the thing about the testing, it's unfortunately not perfect, but it's the best that we have. And I want to explain what I mean. So, ovarian reserve testing, what is that? Normally, it is kind of a few tests that we put together. So, an ultrasound, looking at that ovary, seeing how many like potential eggs that you have on each side. Also, a blood draw, checking your AMH. That helps us the most. Also, FSH and estrogen. Okay, we put all of these things together to kind of give you a good picture or gauge where you're at. Do things look normal for your age? Do they look high? Do they look low? Here's the kind of catch 22. I want to make sure everyone understands when they come and see me. These tests are really meant to be used for like gauging how you would respond in a fertility treatment cycle.
That's the part.
This
That's
is
the
the
part.
important part, not to predict how you or your ability to conceive naturally. And what I mean is, if your testing looks great, I cannot promise you you're going to conceive very easily. You're not going to have a problem. If your testing looks low, I don't want you to panic and think, oh, it's going to be very hard for me to have a child. So,
And yes, go ahead. Sorry.
no, you go ahead.
Well, that's what I was going to say. Like, that's the part that I was like people to really drive home is that, yes, I think that fertility testing, especially if you're in a stage or space where you're thinking about freezing, I think is helpful. And maybe just to
Yeah.
kind of get a
Get
touch
some,
point on where you are in life. But
right.
also that like people can have, find nicks or blips on their fertility testing and then conceive spontaneously. I mean, you see
100%.
people who probably have had IVF who conceive spontaneously, like later.
Exactly. Right. Or if you wait long enough, right, they might conceive. So I think we have the testing, it's the best that we have. I tell patients, okay, this is what it tells me really how things look for your age. If you did a fertility treatment, egg freezing, IVF, even IUI, it helps me to know what dosing should I be giving you and predict how many eggs, if you're doing IVF or egg freezing, that I can get you in an egg retrieval. But it does not predict natural fertility. And also, this was confirmed in a study, a large study that came out in 2017. Lead author was Steiner. They took patients that were getting ready to conceive. So they had not tried yet. These were not infertility patients, right? And they said, let me check their AMH. They thought, or one would think, okay, those with the low AMH, they're not going to get pregnant. The patients or the people in the study that had high AMH, they're going to conceive very easily. But they found no difference. So this tells us, it confirmed to us,
That's
this testing,
huge.
right, really for treatment cannot predict natural fertility, but I agree with you, it can give you some idea. If your
And I
testing looks really good, you might say, you know what, I want to do this, but I have a little bit of time. Versus my testing came back low, maybe I need to try to figure out a way to maybe be more proactive earlier than I originally thought.
Well, see, well, you probably and I'm a huge supporter. So I hope my statements don't sound like I'm not. I'm a huge supporter of egg freezing. I'm a huge supporter of just kind of being aware of one's fertility. But I also feel like what I don't want people to do is get fertility testing. Their ovaries look good, their antral follicle count looks good, and they're like, okay, I'll wait till I'm 43. Wait,
Right.
right?
Right.
Like,
There's still the age part. Correct. There's still the age piece. And we know your ovarian reserve is as high as it's ever going to be the day that you come in for that testing, right? Because with age, it only goes down. We lose a group of eggs every month. And
right.
so we also can't predict the decline. So I
The
can't,
speed of the decline, right?
the
Yeah,
speed of the decline, right? We can't predict it. I can't say this number is 5, next year it's going to be 4. I can't tell you that. So
right.
I think you have to also know as we get older as women, things change. Generally speaking, it happens faster after 35. But I think utilizing testing can give you some idea where you're at. And I think you would agree, right? We've already been given the short end of the fertility stick as women.
Yeah. Yes.
Coming in for testing can at least give you some knowledge and empower you to just talk with your physician to figure out what's the next best thing for you. What is right for you? And that's why it's important to have a doctor that you trust.
Do you also feel like the one thing that at least I think that some of my patients don't realize about egg freezing is that you do want to have a certain number of eggs per like live birth that you want to have eventually, right? So it's like people think, okay, I'm gonna come and do one round and then I'm done. I banked. But it's like it kind of depends on how many you get in relation to your age too, right? Can you
Yes,
speak a little bit about
absolutely.
that?
100%. So this is a part of my counseling for every egg freezing patient that I see on day number 1. So the number that we want you to freeze is completely dependent on your age. The reason why is because age is our best predictor of egg quality. We unfortunately have no tests to say this is your egg quality. Okay, we don't have any tests for that. We use age. So the younger you are, kind of the less eggs that you might need, the older you are, we know that you need more. So if you are 30 up till 35, we know that you ideally need about 15 eggs to give you an 80% likelihood for one baby. Unfortunately, it's not one egg, one baby. We need many eggs to hopefully get us eventually a couple of good embryos. If you ever use them in the future, we want to give you at least a couple chances at pregnancy. By the time you're 38, we know that decline in quality happens a little faster after 35. At 38, the recommendation is really for 30. So now we've doubled the number that we need. It is important for women to know most people do not reach their goal always in just one cycle. It may take more than one cycle. And how we can help you to predict how many you can get, we use the testing, right? If you come in for your testing and I see 20, 30 follicles, that helps me to tell you how many eggs we can get. If you need 30 because you're 38 and your testing tells me we might get 10, now you can start to think it may take me a couple of cycles to get to the number. I always tell women these are ideal goals, but anything that you have, is better than having nothing. I don't want it to feel like a deterrent. Like I'm never going to get to that number, so I shouldn't do it at all. Having
I agree.
something is better than nothing, but these are the ideal numbers we want you to hit. We're always trying to give you an 80% chance of a baby.
I love it. And so I want to ask you one more question because I know we got to go and we're going to do a part two. I think we're going to talk about PCOS. Does that sound
Yeah.
reasonable? Like it will do that another time because I wanted
Yes.
to get into that, but we can't do all that today. So my patient comes into the office. She
Yes.
is 30 because I want to say
Yes.
28, but I want to just split the difference. 30, 30, 28, 32. She's 30 and she says,
Yes.
Doc, I'm not partnered. I know I want kids eventually. I don't know what my fertility looks like. What should that person do? And the answers could be nothing, or go see a REI, or like whatever you think. What would you tell that 30-year-old who doesn't even know what her fertility coverage looks like or anything like that, but knows she wants a baby, but is not on the journey to a baby?
Right.
What does she do today?
I would say ideally, I would encourage that patient to get testing because I believe knowledge is power and it's going to help her to decide what to do in the future. If you get the testing, whether it be with your OBGYN or you come and see me or another REI, now we can counsel you about what things look like for your age. An ultrasound and blood work. And I will say,
That's what I was gonna
if
say, like AMH, like what are we talking
yeah,
about?
I
What are
would
we what
do
are we looking?
mostly if I had to pick two, it's AMH and ultrasound. That helps me
Okay.
the most. Okay. There are some places where if you don't want to have insurance cover this, right? Because insurance doesn't cover it for everyone. where they will offer you like a self-pay price. We're not going to bill insurance, where you get an AMH, you get an FSH or an E2 and an ultrasound at some package price. You know, some places FCI is like 130. Some places I feel like can offer you something in that number. That's a good option for people if insurance doesn't cover. 100, $150, get that information, and then you can use it to decide, am I going to do this? Am I going to figure out options to try to do it? Versus I feel like I can wait a little bit, or maybe you need to save for it. It'll just help you decide what's the right thing to do.
That's fair. I think that's good. I think that's what the people want, what one of the main things that people want to know.
Yes.
Thank you for your time.
Thank
Hopefully
you
your
for
day gets
having
better.
me. I'm so glad we were able to finally do this. For those that don't know, Dr. McDonald and I, we trained both at Rush, which I know we both love.
Yes,
And finally we're able to kind of meet back now that I'm back in Chicago. And
yes.
I really just, what you do is great. All the knowledge that you provide. I know the patients appreciate it. I appreciate what you do. So I'm
Thank
just really
you.
excited that you had me and that we did this together.
And we're gonna do it, and we're gonna do it again. Okay, go
Great.
get your babies. I
Okay.
appreciate you,
Okay. All right.
and have a great rest of your day.
Okay, you too. Happy
Okay, bye.
holidays too.
Happy holiday
Bye.
to you. Bye.
Bye.